Mundeke more donate after another 5 months. Yet to Gamanti, Omchala can donate after every 4 months, Omami after every 3 months. Donating you're donating next year. So we also started to see aspects of donor apathy. But one of the two major factors are community awareness and the chocolate, the people who are selling blood in hospitals. They are causing us a lot of problems. They are causing us a lot of difficulty. And now we want to appeal to them when they could change your habits and so that we can maintain the supply of blood.
Amasomero agegabadde those are leading donors of blood and find that in Singa tamuteza kugwako nga temukampinze ku masomero agenjawulo being young bloods and all that. Now we say amasomero sometimes gagenda mu holidays ngate ne wesanga nazo kuwa crisis. So how does that affect blood donation?
So now first of all, I want to appreciate heads of schools. There are some schools, a few schools that, for lack of a better word, is difficult. They have difficult head teachers, directors. Some of them even within Mbale city. Whenever our teams go there, they don't allow us access to students. But most of the schools, 98% of the schools, allow us to access students. Their teachers mobilize for us students. In a special way, I want to thank the schools within Mbale city. They have been very, very, very cooperative. So, when it comes to schools, abana bali younger, they are more energetic, they have time to listen to you a bit. Tebaina bizibu school fees, pressure, sukari, adenayo meno mukazi, renti, so then they spare a bit of the time. Then, it is easy to appeal to young people. When we go to school, tunonyayo abawala bawala babiri basatu nga basaizi ntonotono. Now when they successfully donate blood olaba ne nawete donating atenze kano yabadde nenaga so like it is easy to appeal to young people as compared to the rest of us about out there. Then after this now the strategy we have employed is that we know the school calendar. So towards the end of the term, we intensify blood collection. And we shall need blood during the holidays. So during the side, depending on how we have prepared it, you can do 35 days or 45 days expiry. And the term is about 3 weeks holidays. Before, not the third term, first and second term holiday. So we intensify blood collection towards the end of the term. So we get a holiday, now we have a good buffer stock of blood. Now, when we go in holidays, we know we are going down the difficult communities. Now, in communities, the blood is not coming in as much, but it is topping up on the already existing stock. So by the time you finish the 3 days holiday, get up for them and now you go back to schools and the situation further normalizes. Now that is the same strategy we employ. Towards the holidays, we intensify. Collect a lot to go on storage. As the holiday starts, you keep consuming a holiday waiting at and the beauty is that as a country we have very young people, the population is still very young. So we have a very big bulk to collect from. Let me give you an example. The other day we were in Mbale, and for 3 days when we worked on A-level.
For 3 days.
This year has been the best donating school. For 3 days when we worked on A-level, 3 days.
For 3 good solid
days. 3 days. Era ekyagobya abantu mu kukoowa abasawo bambuledingana ne bakaga emigongo zifa. For 3 days we only worked on A-level. They were extremely well organized.
Supply a single demand.
No, the supply outweigh the capacity to collect. So we really want to appreciate such schools. They were extremely well organized. You go to school, you go to Mbale and they're extremely organized. You go to Commerce, they give you a lot of support. Toro Girls School is also very excellent. The girls mobilize themselves, they line up very nicely. And even Nakolka Islamic, Bilada Islamic, we've got some very good support from schools. So you started yet towards the holidays, winter spent when I'm on more holidays. Yes, communities. We just top up little by little and manage to go through that period.
Chinkakasa luwabo lwadde abali lying entirely ku musaayi.
Yes.
All through their lives.
Yes.
How does stockouts in most cases affect them?
For example, kakati abalwadde abali ku dialysis abalina endwadde z'ensigo abalina kidney diseases, they need to survive on blood. They receive blood transfusion almost. Every time they are going to do a dialysis, they need blood. You should visit that dialysis unit just one regional referral hospital. So they cannot do without blood. When there is no blood, they just die. They just die. Omudi not donating on side should become a celebrity, should be recognized. Singacha soka, permitted to in a wall of fame, you donate blood to get furniture. Maybe that's what we should actually do to celebrate these people. Because they actually saved lives. Some people purely depend on that blood. Abana have sickle cell anemia. They receive blood almost throughout their lives. And so without the blood they cannot survive. During the rainy season, during the rainy season when malaria is at its peak, baganda banga bagwere bakonja banga bemunyoli awo mwana those belts in high malaria burden. It purely survive with blood. Umwana jana mpika kwa msena there. That's what I'm saying hapa. That's what I'm saying manada kwa. So it is very important to donate blood. Kakati here when wafe mugiso. And with all due respect, together more period of circumcision. Together period of circumcision. There are some people who don't know how to do circumcision very well. So the boys who have been circumcised end up bleeding a lot. Now we are going to see the moment the circumcision is launched, we are going to see an increase in demand of blood. It's an observation we have. Kakati, because of also what goes along with the happiness of Kadoni, I'm assigning you, sometimes the violence, the accidents, you're going to see an increment in demand for blood. Era your period yakadoni, all those vices that could come in that period cause an increment in demand for blood. So it's a period. We now know we have a calendar to manage when this is happening like this. We have this challenge and we need to prepare ourselves for it. Yes.
Friends, blood donations were Eastern Madam Pasira, maternal emergencies, and I think even accidents and malaria.
So our observation is very clear that we have the lowest collections in May. We have the lowest collections in December and in January. May, that April, is mainly associated with agriculture. When it coincides the rains and coinciding with students going into holidays. You go to a trading center and you want to collect blood. And people just look at you. They have their holes, they have their pandas, and they have been doing the agriculture. So that period of late April, May, we see a reduction in collection of blood. The other period which is significant is December, January. Because you could have Christmas and January related brokenness. December, people are traveling for Christmas. People don't want to do anything that risks their enjoyment of Christmas. Late December, for lack of a better word, people are either drinking or they are drunk or they are recovering from drinking. They are extremely very happy and excited. So they don't have time to donate blood. So December, the collections go very low. Now January, people are suffering from the enjoyment of December. After effects of December. So even communities in January are different. You go to people to donate blood in January. What happened in January? Something in a breakfast. Then you know you are what they were. No, they got the inside of Waka sana. So we have a bit of challenges in December and January. So what we've innovated in December and January is we work harder and wider. Tosanga abantu bana mu kifo kye kimu nedda. Osanga abantu babiri nga banoonya omusaayi. bwe tukwata tigamba tukutte ekkubo lya Bugema, obana babiri ku toto, abalala n'obateeka ku checkpoint, abalala n'obateeka mu nkaaga ababiri, abalala n'obateeka wali ku mafuta side ya, abalala n'obateeka ali e Bugema. So that the two people you have put in one place may end up collecting 10 units over the whole day. Wow. But at the end of the day, you have 8 teams along that road, and you have 80 units of blood. So we spread ourselves so thin. We try to reach out to as many people as possible. They walk with simple. Walk with simple sawe. No ngamba Dr. Bumba nyagala nga bamusayi. Tuli wane wange tuli abantu bana. Twagala bamusayi mujje tutujja. You know musayi. Ne mu January no ngamba ndi wati oli wana maguma oli bana ndi batano ekakazije. So in January and December we're extremely mobile. We're extremely mobile. Then as we go deeper into the villages, people need to be appreciated. So we also come up with some recognition and awards that we actually give blood donors to try to motivate people. Kubanga bomusayi sina chenali mfunyaga banona kebya sino ne certificate yi ruba mbera ngale sikira skali geno nyomo kachai mbere tabuse ababoda kale kankole lita ya mafuta. So we try to innovate in January Brabant. We don't get into a crisis. Important. Wali de kamere bojange njale kuluma tusaba kuzanga bamusayi Boja mu January njale kuluma soka kuya chabi sana. Mu January nazojoga bamusaga bejale numa na ndayo mwana waliye bagasema batasa mdona mwe kamera bando neti bamusayi. So what did they come in? We will not here. Are you generally in good condition? Even just your mental state. No, I'm on better. Okay, yo, mama, I am to see them punch. Yeah, what's the way that we're running? Not stress as a ninja. Will not allow you to do that. So many no one are generally healthy. Amount of people who drink alcohol can donate blood. Now, what time you they don't. Baba mutabivu no me kubula kama professor don't allow them to donate blood what are you kosobola mu so tukeza ko kulaba nti omuntu yenna na donating omusayi their blood is safe but it's also safe for them to donate kasika tukusana no gamba nti ndikubuza okola mu muchi no gamba nze tunda kabozi kachukuru will not allow you to donate blood because you have risky behavior. Singa tukusanga okwesebera galagala you're a drug addict. That's what is happening. You're high risk. Your blood is high risk. Kasinga tukusanga nga gwe olinamu obulwadde nawe tetukujjako omusayi kubanga ate gwe twakakosa bulamu. So it's both ways. Twagala omusayi gubenga mulungi oli bulungi gwe mwenyeseza omusayi bulungi ate twagala tukujjako omusayi tunakola ki tukosobola. So we try to make sure that the donor is protected and eventually the recipient is also protected. So bwe tumala okusoloza omusayi awo wewona tuba tukusanze kyekiraga omusayi tukukebera tukebera hepatitis B, hepatitis C, HIV ne syphilis. Then tukebera ne blood group. Tetutera kubiriza abantu kujja wano ku blood bank tetukebera abantu musayi nedda. Era bwojja nogamba bannange blood bank mumenya ebyuma birungi nakashuwa kange nakafunye nje yakakebera kawuka kasirimu ndyoke kajjeko obulago. We don't offer such services. We don't offer such services. Tugamba nedda ffe tukebera omusayi oguliki oguli donated. N'omuntu bw'aba donated omusayi they can always come back and we give them their results. But we don't encourage people to donate number. Can you think about jumping to the way? But just the two color. Suppose Valabla will say, there's a little to a in Navy. They are back and if you say, oh, we don't do that. We don't encourage that. We don't encourage that. So we do HIV testing, hepatitis B, hepatitis C, syphilis, and then the rest of blood groups. And we have the best technologies in the country. Yeah, we have the best technologies in the country for testing these diseases. Now, after we've tested the blood, we will know what process does the blood go through. So we store the blood here. As a blood bank, we store the blood here. Amalwaliro negajja gakimwana omusaayi. Kati obuzibwa tufunye nti we have scenarios where we have good stock of blood here, but the blood is not in the hospitals. Era kituyisa bubi nnyo. Mulimu amalwaliro mangi nnyo ag'obulankanya to come and pick blood. They don't want to incur that cost of coming to pick blood. But in our often emergency situation, and that's what we want to avoid. But we have to go Busia. No man go funny omulwadde omukyala ali okubulidinga. Busia to Mbale is 1 hour and Mbale back Busia is another. Those are 2 hours of time lost. But if you had picked your blood and stored it there, then that mother will be able to access it immediately. So what we are doing now is provide those health facilities that are having reluctance to pick blood. What we remember now, every health facility should plan to pick blood at least once every 2 weeks. But you know, we can give you blood to take you for 2 weeks. But after 2 weeks, come back, they're going to collect it. They're going to put so that every other time we have blood in the hospitals. Now, another thing we are seeing is olumu omusaayi mu ddwaliro naye ng'akola mulamu gye bateresa omusaayi yagenze ekisomero kya fridge. Omusaayi teguliiwo lwaki? Omusawo yagenze ekisomero kya fridge oba ekyalaamu. So we have now taken our efforts now from the blood bank. Not you know omusaayi mungi, you know omusaayi gumala. But we are now going to health facilities to help systems mu ddwaliro okutereera okweyongera okutereera to make sure that people can access the blood. So that is some of the efforts now we are putting energy into. The blood, when it is in the health facilities, it is also easily accessed free, whether in private or public health facility, accessed free in the health facilities. And the other issue I want to add is that we want to appeal to organizations to have plans for their staff to donate blood. In a special Nairobi to Jega community outreach, but besides the Malara, we have appointments with them throughout the year. They have decided that every year they will have 3 blood donation days. So we have planned for them. So to some, if other organizations can also adopt that and work with us, even if you're just 5 people who are going to donate blood, we'll have with you appointments, we'll come with corporate branding, and we'll be able to reach out to you. So media houses donating during this period, and we have that. There's a strategy that we have a sustained supply of blood. Now, from blood, we can give a patient blood, the whole of it, but we can also remove some products from the blood. We know what we call platelets and fresh frozen plasma. We ambaka abantu abalina bleeding disorders, or if somebody is bleeding too much. So to take abantu, the health workers who are out there, that we have capacity to provide you platelets and fresh frozen plasma. So you ask for these things as well. To be taker, and they expire on our hands because you are not asking for them. So I have to use this chance to inform the health workers out there that at the Mbale blood bank, we are able to prepare platelets and fresh frozen plasma and cryoprecipitate on demand. So if you have patients with bleeding disorders or patients who need platelets or fresh frozen plasma, please, you can pick them from us. We already have these products available. So our products we efficiently use the blood. In a special way, abantu bonna who are involved in mobilizing blood donors, whether it's organizations or it is individuals, we really appreciate your efforts. Okugaba for the first time is not a joke. Era for us to gaba nti mu bantu wega nawe 10 atagaba ngako omusaayi. If you successfully convince one to donate, you have actually done very well. So I want to appeal to people who do blood donation mobilization. We thank them so much because they are helping us improve on our stock of blood?
Maybe ngabe kubumba abantu abalina private clinics.
Yes.
Basobola okufuna what the drives of the blood donations.
Yes. Now, first of all, even private clinics that want to start offering blood donation, blood transfusion services, we accredit them. If you have a private facility and you want to start offering blood transfusion services, we can accredit you, because we believe blood should be readily available everywhere in the country, in any corner of the country, whether in a private setting or public setting, because you never know where you're going to need the blood from. So we want blood to be readily available everywhere. Now, with private health facilities, they need to get accredited by us. So what one here, and we go and inspect. The Kakasa by the Visani, so you have one more side. Right now, right now free, right now storage for services, the budget charging, right now equipment is testing on side, and all those things we go and accredit. So we accredit private facilities. Anybody, anywhere who wants to mobilize blood donors is welcome. Anybody, anywhere, whether political leaders, religious leaders, culture. We had successful campaigns in Kampala when we have with the Kabaka Foundation. Nasaba sajja mwingine yakolaki. Yakulembera okola abantu nga bomusaayi. We had successful campaigns nakola ne ikomanya wa Mbale ne wayabire. Naye we've not had a lot of penetration with Inzuya Umbuha because of the challenges they've had. But all cultural leaders can as well help us to mobilize blood. Anybody, anyway, who can mobilize blood donors, we are happy to work with. Kwebaza. In a special way, kwebaza our blood donors. The best we can tell you is thank you, but you should know that the blood you donate saves lives. And the people who receive it are extremely very grateful. You have given many people a chance at life again because of the blood you donate. So please, keep donating your blood because your blood saves lives.
Maybe nature, makachibuzo. Mimi abantu bagamba aizo kuwera from nowhere nagamba zindirede. Asola okugenda mu dwayo ne byokumbi nagamba nze kudolinga mu sayi bayina kulinda.
Uganda Blood Transfusion Service, perfect camp in the country, are allowed to collect blood. This work of collecting blood is like a sub-specialization. Equipment is of Zanjaulo, the handling of blood is special, the storage is special. So anybody who wants to donate blood can only do it at with our staff, with our structures. So we always share our programs in our field. Now about 1 year, the regional blood bank can always come here and donate blood. During this school period, we are here 8 to 6 p.m. Monday to Friday. We don't work on Saturday and Sunday. Now January and December, we go at 24/7. They say January, December, but if you came here at midnight, there will be people to receive blood from you. But as of now, because we have very good stock, we can reserve you adults for December and January. So that's why we're not so aggressive right now with the adult, with the who are out of school population. Yes.
Maybe because you see what I want.
So banali, tweyanziza nnyo. Mossad Media, yes. Keep yourselves on Mossad Media. Like it, subscribe, repost, share, and there is a social media page. But we have ELGON Times Media as well. So please support these media houses because they are doing a lot of charitable work. But they are going to give this information out, so please support them. And they're also supporting us reach out to the population out there.
Dr. Bumba Ahmed, mutubadde lunaku olwaleero ono manager wa Mbale Regional Blood Bank. Akumenyedde wagyeekoma lwakuba nti ekyomusomo nti tibagudde already Muteeso that is Soroti egenda kuyambako ku mirimu gyegimu egy'omusaayi naye nga nangenda kwongerako eddoboozi tono ensonga y'okuwola omusaayi. Kino tokikola nti olina omuntu gw'osuubira owo agenda okuba kabenje, wabula okikola olw'omuntu gw'otamanyi agenda okudda engulu olw'omusaayi gwamuwa. So toteekawo nnyo okwakuliza ng'ogaba omusaayi ng'ate simanyanga lwaki mugaba soda, lwaki temutwa soda ne juice. Nedda kikole olw'obulamu bw'omuntu omulala gw'otomanyi, kubanga tomanya ne gw'oyinza kutaasa. Oyinza okutaasa omuntu aye naawe agenda okutaasa omwana wo kuba omuzzukulu wo
mu future. So kikole ku lw'obulungi bwonzo ndi omu kubagabye omusaayi by the way era nze ngugabira aloni wentudde Regional Blood Bank si mulundi gumu sebiri sesatu mirundi egiwerako ddala naye nga sisuubira kubaako nakinfuna nga nzogaba omusaayi so nawe sokikolanga nga omuntu omulala yenna n'ogaba omusaayi kubanga kiyinza obutayamba gwe oba omwana wo kiyamba omuntu fa relative wotomenya kumanya nti yasurvivinga olw'omusaayi gwo. Until next time.